Some suggestions for men with severe PE, because a few guys have seen my videos and said, yeah, the breathing and the relaxation methods and the mindset techniques, that's all right for men who are enjoying intercourse or receiving oral and want to do it for longer. But some men come within a few seconds, before or just after penetration, sometimes with the slightest touch, and there isn't time to get into flow because the guy's over the finish line already. There are quite a few men in this situation, sometimes called rapid ejaculation or severe premature ejaculation. Also ante portas ejaculation, before penetration, meaning before the gates in Latin. And even though there's loads of advice and courses and products for overcoming PE, I think this aspect of the problem, really rapid ejaculation, is a bit neglected. It's not really understood. And I've seen delay products that say, specifically in the instructions, that they are for men who already last for 30 seconds or so. So they're covering themselves there. Sex therapists say it's not all about how long you last. With connection and creativity, great sex doesn't need to be for a certain duration. We can give and receive a lot of pleasure in seconds, minutes, whatever. And this is true. I say similar things. But I understand guys feeling fobbed off with that, particularly guys on the much quicker side, because they want to enjoy intercourse and receive oral, and their partners want that too. Yes, there are lots of ways to have sex, and they don't all involve your penis. Explore all the ways to give and receive pleasure. But you really don't need to give up on using your penis. There really is more we can do here. Remember that the arousal curve from getting an erection to ejaculation is dependent on your nervous system. That erection happens in the relaxed state, the parasympathetic, blood-flowing, receptive state. And then as you get more excited, however soon that happens, you switch to the sympathetic, activated, going for it state, and then boom, ejaculation. Now that curve isn't usually a straight line. We stop, we start, we breathe, we calm down, we change position, etc. And it fluctuates. Most guys find that after a couple of big waves, and then they ride out and they settle for a while. They plateau. But rapid ejaculation is more like a straight line, and it all happens in seconds. Isn't the body amazing and annoying? But the key thing here, and it's good news, that shift, that process is still happening, and that means we can slow it down. Now, one possible exception is guys who experience SE, spontaneous ejaculation. Now, this is the rarest of the ejaculation dysfunctions, but it is a thing. Ejaculation that happens without any sexual stimulation at all. It takes you by surprise, maybe when going to the toilet or in the middle of a really panicky situation like an exam. This is rare, and you may probably never have experienced it. And if you have, there's usually more going on. There's been some kind of trauma or injury, or a medication is doing weird things to dopamine and serotonin levels. Guys with rapid ejaculation often say that their penis feels hyper-excitable, hypersensitive, but they still need some element of touch or some sexual stimulation to reach ejaculation. It might be sudden, but it's not taking them completely by surprise. And that leads us nicely to skin sensitivity, which is a big factor in rapid ejaculation. Some guys are very responsive, reactive to touch, heat, sensation down there. See my other videos for ways to gradually reduce sensitivity, and using penis root masturbation is a starting point. And if you try my self-help course, you'll find a whole section and an action plan exactly on how to do this. It's specifically for men who need to build up this foundation first. We need to be able to absorb sensation for 10, 20, 30 seconds before we can really get going with other techniques. Acclimatizing ourselves to more touch and intensity, one step at a time. There's a psychological side to rapid ejaculation too. Guys want to be sexual, but they expect the problem to happen because it's happened before. So a big mix of desire and dread at the same time. It's performance anxiety ramped up, right up, usually with added shame and embarrassment too. So there's work we can do here too, some degree of acceptance. Yes, we have a tendency here. We might need to develop skills that other guys don't need, but it doesn't need to limit our sexual potential. And opening up to our partners and working with them, taking some of that performance pressure off, that really helps too. Quite often guys have experienced trauma around this, bad memories, bad sexual encounters, a partner who was cruel about it, or they felt like the partner was being cruel. Hence those feelings of shame and inadequacy that keep visiting every time we feel sexual. Now, there are things we can do in therapy to put this stuff properly in the past, emotionally. See my rewind video. So getting past coming in seconds. This means some physical solo training, developing that tolerance to touch, and then some mindset work, maybe. Now, it is quite a revelation when you really experience being and staying aroused for longer. It's like, look at this. I've been going for a couple of minutes and I'm still going. Wow. And then confidence builds from there. And I've seen this approach work really well with guys who were coming within a few seconds. Take some perseverance. The results weren't instant, but it was all doable. And there are other options too. SSRI medication can make a noticeable difference here, raising serotonin levels and slowing down the ejaculation reflex. For men with rapid ejaculation, severe PE, I think there's probably more of a case for supplementing therapy with an SSRI medication. Again, it'll just help give you more time to work on your technique. And it can be a short-term thing, as long as you're building your skills and you're not just relying on the meds. And SSRIs like paroxetine, citalopram, sertraline, they're also prescribed for spontaneous ejaculation too, so it does have an effect here. There are more drastic treatments for penile sensitivity, like circumcision, Botox injections, transcutaneous posterior tibial nerve stimulation, and you can check my other videos for more about those approaches. And as ever, you should speak with your doctor if you're considering any of this stuff, or if you have any concerns at all about your sexual function. Don't rely on some therapist on YouTube. I hope this helps address some of the stigma and the anxiety around this issue and gives you a few signposts to ways forward. Rapid ejaculation can be challenging, but it's certainly not uncommon and it's not untreatable. Thank you, as ever, for watching.